Welcome to the Group Dentistry Now show, the voice of the DSO industry. Kim Larson and Bill Neumann talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
I'd like to welcome everyone to the Group Dentistry Now show. I'm Bill Neumann, and as always, we have great guests on the show. So first off, thanks everybody for listening in today. Without an audience, we couldn't do this. And of course, without great guests, there wouldn't be any audience. So we have two wonderful guests here today. And actually, some of you are going to get a chance to hear them speak in person. If you're getting this audio podcast before the Dykema DSO event, which is the end of July, then you'll actually, hopefully, if you're going to be there, get the chance to hear these two gentlemen speak. So we have Andrew Floyd, who is the VP of Customer Acquisition and Growth at Smile Direct Club with us today. And we also have John Sheldon, who is the Chief Marketing Officer, also at Smile Direct Club today. So first off, both of you, thanks for being here.
Thank you.
Thank you.
Yeah, great. So, and interesting enough, both of you have different roles that you're going to be playing at the Dykema DSO Conference. You're going to be speaking at different panel discussions. One of them is actually called the Consumerization of Healthcare, and that's where John is going to be speaking on a panel discussion. And then we also have Andrew, who looks like Andrew's going to be doing a breakout session, and that looks like that is going to be marketing hacks to grow patient acquisition. So before we get into that and some of the details of that, both those discussions, Andrew, could you give us a little bit of your background? You're the VP of Customer Acquisition and Growth at Smile Direct Club. Can you give us a brief bio?
Yeah, sure. So thank you, first and foremost. So I've been with Smile Direct Club for roughly 10 months now, so I'm relatively new. But I joined by way of Walmart, where I spent the last 10 years of my career. Prior to that, I was with agencies leading anything from CPG to financial services marketing, but really cut my teeth in terms of performance and digital. And so excited to be a part of the team and excited to contribute to the Dykema Conference.
Thanks, Andrew. And John Sheldon is the Chief Marketing Officer at Smile Direct Club. John, can you give us a brief bio on yourself?
Yeah, I've been with the company for 3 years. Before that, I've had a pretty expansive experience in working with companies doing digital transformation or being in and around kind of the e-commerce space for over 25 years. And so whether that's been on the agency side or the client side, I've worked for MasterCard, I've worked for eBay, really helping both big companies and a bunch of startup companies get off the ground, as well as big companies that needed to launch their digital businesses. The thing I love most about Smile Direct Club has been just how quickly the company has grown and been able to help them as we've continue to grow this not only in the U.S. but in 13 other countries.
And maybe what we should do, I think, and probably most of the audience knows who Smile Direct Club is, but I do think it would be worthwhile, John, if you don't mind, to maybe just touch on the business a little bit of background, and then we'll get into what you both will be doing, both you and Andrew will be doing at the Dykema meeting from the standpoint of providing important content there. But just a little background on Smile Direct Club, if you don't mind.
Yeah, great. So Smile Direct Club's a relatively young company, 7 years old. From the time that the first email was sent was like, hey, do you think anybody would do this? The company is really created to help people understand the life-changing potential of having a smile that they love. And so what we've done, launched originally in the direct-to-consumer teeth straightening business, always doctor directed, of course, and worked to grow that piece of the business. And now we've grown that up and are working in multiple ways for people to get started in the business, whether that's an impression kit to get the initial impressions, visiting one of our smile shops, or starting at one of our partner network locations, which we started building that partner network last year. We have 1,500 locations up. And actually, the company has grown to the point now where we have well over 1 million folks who've kind of completed treatment with us, and so I've been a really big part of a lot of those folks' lives and beginnings of their transformations. And last year, additionally, as part of our focus on helping with smiles, we actually launched a products business, started in Walmart, but we have whitening, toothbrush, water flosser, some other oral care products as well, and those have grown very significantly over the last year, and are challenging some of the industry leaders.
Yeah, really cool. So only 7 years old and already a million cases completed.
Yeah, it's been great, and the business model is one that frankly has benefited somewhat. With people's comfort now with telehealth, and we've always had a virtual model as part of the treatment, and in a world where people couldn't or didn't want to go to a place and open their mouth, having a virtual treatment option and one with 24/7 support was a really good one for people, and so the businesses continued to stay robust.
Excellent. So let's talk a little bit about the conference coming up next week. And again, depending on when you're listening to this podcast, it may have already passed. You may grab this podcast right before it starts. You may not be attending the conference, but regardless, we're going to give you a little bit of flavor for what both John and Andrew are speaking about at the conference. And if you are going to be there and you do listen to this before you get there, stop by and make sure that you listen in. So first one is going to be John Sheldon. He's going to be on the panel discussion. It's Consumerization of Healthcare. And that's actually you're going to be there with Steve Bilt as well, who's the CEO of Smile Brands. So right. Let's talk a little bit about what that's going to, what you're going to discuss there, and give us as much as you're willing to share right now. I know you want to hold some back for the meeting.
I'll hold a little back for the conference, but I'm super excited to share the stage with Steve Bilt. He's a spectacular leader for Smile Brands. And really what he and I are both going to be talking about is how, Smile Direct Club and Smile Brands are really focused on how we put the customer first in the process. The different techniques that we utilize to listen to what the consumer is looking for in their dental care, and how we have shifted what that customer experience looks like to kind of meet those needs versus just simply catering to what the doctor wants, which also, by the way, also very important. Again, both of us, believe strongly in having the medical professionals as part of the process, but we've added a lot more to the customer experience side of the equation, and we're going to talk somewhat about that. And it's in line, frankly, with the kinds of shifts that we're seeing in a number of different industries, right? Whether it's in IT, with people bringing, BYOD, product into the corporate networks, or food, where consumers are really demanding much greater transparency on ingredients and knowing where their food comes from. So it's taking what's happening in other industries and bringing it straight into the world of dentistry and teeth straightening.
Excellent, good stuff. So that'll actually be the first panel discussion. It looks like that starts on Thursday. So that'll be one in the afternoon. And then actually right after that, it looks like we have Andrew Floyd, and he actually is going to have a breakout session pretty much right after lunch, it looks like. And that's going to be digital marketing hacks to drive patient acquisition. So Andrew, you mind touching on a couple of things you're going to discuss in that breakout session?
Yeah, I think it's going to be a lot of fun, Bill. I'm hosting an interactive breakout session. The focus is tips or hacks for incremental patient acquisition. And the background here is that I have two little 7-year-old boys. And to be honest with you, their teeth are like chocolate chips, and they're on a steady regimen of Prevident 5000. And we just recently moved from Bentonville, Arkansas to St. Louis, Missouri. And so in my quest to find a new dentist, I've noticed a lot of opportunities. And so I sat down and said, I want to document all of these different digital opportunities, but I want to put some rules around it. I want to give nuggets for the attendees. And the rules are really basic. One is I want to make sure that everybody gets something of value, whether you have a marketing team or you don't have a marketing team. I'm going to give you a tip or a nugget you can take home. They have to be simple to implement. you have a day job. You don't need to be a tech expert. They can't cost a ton of money. I've been joking that these are incremental patient acquisition on a floss string budget. They can't be time consuming, and we're going to leave you with something you can take back by way of either article links, videos, or tutorials, so that you can put some of these nuggets into practice right away. Should be a really good breakout event.
Yeah, it sounds great. I mean, you kind of look back at what some of the pain points are of DSOs and solo practitioners as well, right? It doesn't matter if you have one location or you have 1,000. Patient acquisition and then retention is probably right up there as well. So, what can you do to keep the patients happy, right? Keep them coming back, and how do you find more patients? And then I think it really ties in, Andrew, what you're going to be speaking about with the consumerization of healthcare, and really what John's going to be talking about with Steve Bilt. I mean, John, do you see, kind of based on your experience, I mean, where is dentistry compared to maybe some other healthcare verticals when it comes to consumerization? Where does the industry stand?
Yeah, I think on the whole, there's a lot of opportunity. Bill, I think, you take a look at, some of the different parts of the business, the places that have done the best are the ones that are really the more elective in nature, where they've really had to pull in, better consumer experiences and better ways of marketing, and to the customers to enable themselves to drive the demand that's necessary. And the places that are a little bit more kind of mandatory, come in every 6 months, so on, have lagged a little bit. And by the way, the most successful doctors with the most full practices, often think to themselves, I don't have to do this. I've got a full schedule. I don't have to worry about it. And then it's really the young and hungry dentists growing in the industry who are saying, I got to figure out how to grow my practice. And so those are the folks that are really kind of pioneering the consumerization within dentistry, and also obviously great DSOs like Smile Brands, that are really helping bring that to dozens, hundreds of offices, sometimes at the same time.
Excellent. And Andrew, I know you kind of in your breakout session, you're going to be talking about your journey trying to find a new dentist. What are your thoughts on do you see consumerization with some of the dentists that you were vetting out as you started to try and find somebody to work with?
I think there are a litany of different opportunities in this space, whether that be through just leaning into local community opportunities, or there's paid opportunities to drive incremental net patient acquisition. So I think there's something for everybody, regardless of where you are in terms of your maturity with marketing or where you are in your maturity with your business.
Yeah, and Bill, if I could just add to Andrew's point, as we've been growing out our partner network, and we've got over 1,500 locations now in that partner network. I mean, it's the thing we hear most from the partners is, how can we market like Smile Direct Club? How can we create an end-to-end experience, as cohesively as you guys have done? And so, really, I'm super excited that Andrew is going to be able to kind of take a lot of the tips and tricks from our own business and share that with the audience.
Yeah, that's a great point, and actually kind of leads into this next topic, which is really Smile Direct Club and maybe some of the myths surrounding the organization, and you have this partner network now, and there was probably a little bit of hesitation from some of the practices or DSOs initially. So let's get that all out there and talk a little bit about some of the myths that maybe clinicians have and even DSOs still have.
Sure, let's do it.
All right. Well, you want to start off, John? Let's just talk to me a little bit about what you've heard in the past, and maybe what's true and what's not true.
Yeah, let's dispel a myth right out of the gate. I mentioned it right up front, but it comes back over and over again. Sometimes from some of the industry associations, often from dentists who have a mistaken impression about the business. They say there are no doctors involved, and this is DIY orthodontics. Nothing could be further from the truth. We have hundreds of state licensed dentists and orthodontists. Every customer is given a person licensed in their state who's responsible for their treatment on an end-to-end basis. Every Smile Direct Club doctor has 5+ years of clear aligner experience. We have some of the most experienced doctors in the industry, and so that teledentistry platform that we utilize allows for that bidirectional communication from the customer to the dental team, including to their doctor.
Andrew, I don't know if you want to chime in a little bit there with anything that you would like to dispel, or maybe just any misinformation or misunderstandings that the industry might have.
Yeah, I think an interesting one is that we're less expensive. So as a less expensive aligner, we must be lower quality, which is that simply isn't true. There are a few ways that we save money, and we sell you these affordable aligners simply by cutting out the middlemen. We handle everything in-house. It reduces our overall cost, the cost that we can sell to you. And because there's no dentist or orthodontist who marks them up to make a profit, we can send them directly to you, cut out shipping cost, and those savings are spread across our members.
Yeah, the dentists are part of our network, and they're and we obviously pay them for the work that they're doing, but they're not reselling them. It is often a 3 times markup in the industry.
Yeah, great points. I mean, you've got Smile Direct Club has some great brand equity with the consumers, right? So let's talk a little bit about that. I mean, you started off direct to consumer, so talk a little bit about that brand equity. What was it like kind of building the brand? And then I'm kind of curious, is there any significant data that you can share from the customer perspective that might be able to help out these DSOs and emerging groups that maybe aren't quite as tied to that, direct to consumer, right? I always kind of look at it, you've got old school dental practices look at the patient, right? But they don't treat them like a consumer. It's like almost like a different thing if we deliver, great quality dental care and we're taking care of the patient, but the patient now wants everything, right? They want that consumer-like experience, which means, we expect great patient care. And we also want it conveniently, and we want to be in a great space, and we want to have teledentistry and have solutions that make things easier.
Yeah, I mean, Bill, the first part starts right at the beginning of how people come to know our brand, right? Obviously, we've done a really nice job with our branding and creating that consistently, and being really all about helping people understand the intrinsic value that a smile brings to them so that they can go impact the parts of the world that they want to impact. And we message that, pretty broadly, but we do that in a way that's convenient, obviously costs 60% less, and frankly, make it accessible in a way that's never been done before. There are 60% of the counties in the United States do not have an orthodontist in the county. We service all those people. So by providing that access to care at an affordable price in a way that's really convenient, that really meeting of 3 really big consumer needs right out of the gate there. And then the second piece comes with the way that we now let consumers start any way they want, right? We started the business with the impression kit that we would mail to them for people who wanted to do that at home. Then we introduced the shops and have 100+ shops, in the market where people can come in and get a, Apple Store like experience with a smile guide who can kind of help them understand what the journey is going to be like. Good news is in the pandemic, when those shops had to close down, we had the kits, right? And so people switched back to those kits and did that. And they have, huge agility in our business to be able to swap back and forth between those two. And now third, what we've opened up is the ability to go to your own dentist, right? Add a Smile Brands, add one of the DSOs or the individual doctor's offices that we've now turned on with the partner network. So just meeting them where they are, helping them get connected to the journey of teeth straightening in a way that they want. And then the good news on the back end, the consumers respond. Andrew, why don't you hit some of the statistics on all the different ways that consumers, after they get through treatment, how beneficial it is on a broad basis?
Yeah, what I know is it's so rewarding to be a part of Smile Direct Club because we know that we're having a life-changing impact on our members. The truth is that 7 in 10 members once hid their smile before Smile Direct Club. Now, after Smile Direct Club, only 1 in 10 do so. The majority of people said that they smile a lot more after their treatments, and 1/3 of respondents believe that their smile is actually worth a week of vacation or a weekend getaway. What I think is really interesting is that 1 in 8 of our members said that they've lost weight as a result of our treatment, and 1 in 7 said that they go to the dentist more regularly. So we're not just having a benefit on oral health care, we're having a benefit on overall well-being.
Yeah, just to piggyback on those points from Andrew, this is where I think we feel really aligned with dentists, right? We both have the oral health of our patients in mind, and so the fact that they're more likely to floss, they're more likely to go to the dentist, they're more likely to take care of their smiles in general is right in line with some of the key things that we know are important to the dentists in our partner network or beyond.
So, John, you mentioned earlier in the podcast that the partner network is relatively new for Smile Direct Club. So, what consumer insight really drove Smile Direct Club to say, hey, we need to create this partner network? And then let's talk a little bit about, what does it look like from the DSO, the emerging group, the partners perspective?
Yeah, so great question. So the key insight is one that's not that surprising, which is some people really want to talk to their own dentist about how to treat and get to the smile that they love before they begin a treatment. Or somebody that they're already working with, someone they know and that they trust. And so by turning on all these locations, it enables them to be able to go do that. And there's some people, by the way, who don't have a dental home today, but want to talk face to face with a dentist in their neighborhood, as opposed to, our shops are often in center cities, that kind of thing. But they want to talk to a dentist in their neighborhood about it before they begin the treatment plans. And so, that's, really what we've done by flipping on, these locations is made that really easy for them. But we've also made it really easy for those dentists because, they're likely not experts in clear aligner therapy per se, although we educate them a lot on it as we turn their offices on. And really what we work with them on is how to have either themselves or their hygienists, do the scans for the customer, which is kind of really the after their checkup is really the key before they get started in looking at a treatment plan. And so all the dentist really needs to do is do a little bit of education, answer the questions of the consumer. Make sure their mouths are healthy, get the scan, and then it's over to us, and we take it from there. And obviously, as appropriate, that relationship is one that helps grow their business in a number of ways. We can send them leads of people who are looking for dental homes as well. And so it's a really great way for a dentist to grow their business, and it's one that can be economically beneficial for them as well.
Excellent. Yeah, the lead generation would certainly be a plus for any group. That's good. Let's kind of finish things up here, and then I want to make sure that we kind of review again when you'll be speaking at the Dykema meeting. If people happen to miss that, of course, we'll drop your contact information in the podcast notes so people can reach out and find out more about Smile Direct Club from a partner network perspective. Let's talk a little bit about patient loyalty. Talk about building that. And I think Andrew's going to talk a little bit about some of that. I'm sure you'll both talk about that at the Dykema meeting. But how do you do that? And then what is Smile Direct Club, from a referral standpoint, kind of how do you look at that?
Yeah, I mean, referrals are exceedingly important to our business, right? The word of mouth is as important as ever. And actually, in today's world, it actually has a disproportionate impact because of the one-to-many of online reviews and so on. And so we're super excited that our shops have a 4.9 average review on Google. And so it's just getting that referral, getting that word of mouth is helps build the trust we are a relatively new model. As I mentioned at the beginning, we're a fairly young business, but the good news is the results that people get and the fact that we guarantee those results with our lifetime smile guarantee, allow customers to have confidence that we're going to stay with them until they kind of get the results that they're looking for. And that's what they go and tell their friends, their family, and others who probably have been thinking some of the same things quietly to themselves about that one tooth that won't move, or I don't like my gap, or I've got a lot of crowding in my bottom. Boy, I really should have worn my retainer. Any of those kind of elements, and so that word of mouth often kicks off the conversation that helps us. But again, the other part of it is that loyalty is staying in the. We want customers to stay in their retainer. And stay and so on, and so our clear aligner retainers are replaced every 6 months, and so we want to make sure that they stay with that process for years and years, so they don't end up becoming customers again in 5 years because their teeth have slid forward or moved back, and so that retention component is really essential, and obviously we want that to be the doorway to a relationship with us more broadly in the oral care space. People who straighten their teeth are much more likely to whiten. People who are looking to move up from standard brushes to electric toothbrushes tend to have significantly better oral health, and so trying to work with them kind of on just thinking more expansively about their end-to-end oral care is all part of that loyalty.
Excellent. Andrew, anything you'd like to add?
I think referral is so unbelievably important, and reviews are so unbelievably important. And so as a business, the easier we make it, the more seamless we make it, the more enjoyable we can make it. And that creates irrational brand love. And we believe that we're changing people's lives through the power of a smile. And we believe we have a transformative product and a transformative company.
That's great, Andrew. And I want to go back to one thing that John mentioned, because he did another myth bust there when you talked about the ratings. That what was it 4.9? Is that what you had said?
4.9 average. Yeah.
So I mean that doesn't say it all there. That's great. That's great. Listen, let's just wrap things up here. What I want to do is, first off, thank you, John and Andrew, for taking some time out of your day, telling us everything. You're gonna give everybody a little bit of a sneak peek at what you're going to talk about at the Dykema DSO Conference. It sounds like it's going to be a huge event. I think the last I heard, there are going to be about 1,100 attendees there. So no pressure, guys. Just throwing that out there. But it's next Thursday, and again, depends on when you're listening to this. But they're both going to be speaking. There is the Consumerization of Healthcare. That's the panel discussion. That'll be John Sheldon and Steve Bilt. And then we've got the breakout session right after that, really. And that is going to be digital marketing hacks to drive patient acquisition. And Andrew Floyd's going to be solo on that one. So, and then actually later on that night is, I think you guys are sponsoring a reception and or co-sponsoring it. It looks like there's going to be fireworks and some 80s band. So it sounds like a lot of fun. I'm really looking forward to it. And, if you can attend or you're not able to attend, then certainly you got a sneak peek here. You can reach out. We'll drop John's contact information and Andrew's contact information in the show notes. Chris Thompson handles the partner network, so you can reach out to Chris. We'll have his contact info in the show notes as well. So, with that, I'd just like to thank again Andrew Floyd, who's the VP of Customer Acquisition and Growth at Smile Direct Club, and John Sheldon, who is the Chief Marketing Officer at Smile Direct Club, for being here today. Thanks, guys.
Thanks so much, Bill.
Hope to see everybody at the Dykema meeting. Until next time, I'm Bill Neumann, and this is the Group Dentistry Now Show.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today and please tell your colleagues about us.